There's a new report out that found that taxpayers paying almost $400 million just treating gunshot wounds in New York City hospitals alone. Let's go now to our national correspondent, Axel Tercios, who is live in New York City. And Axel, what can you tell us about this report?
Hey, Del, what we've learned with this report is that every resident in New York City for the last decade that's been paying taxes has been paying millions of dollars to cover medical expenses for those people who are injured by gun violence. We're talking about 70%, more than 70% of those medical bills. The researchers who did this study told us that this is something that is not only isolated to New York City, but something that every community should be concerned about.
The cost of gun violence in America can be measured in loss of life and enduring pain, and it also can be measured in dollars.
At least pay attention to the dollars. Pay attention to the money this is costing taxpayers all over the country.
In New York City, a new study finds taxpayers pick up between $30 and $40 million a year in medical bills for gunshot victims.
A massive proportion of this cost is covered by Medicare and Medicaid.
Researchers at New York's John Jay College of Criminal Justice found that between 2010 and 2020, taxpayers shelled out at least $315 million to care for survivors of gun violence. The report says taxpayers are paying more than 70% of hospital costs.
The medical costs are just a portion.
Dr. Jeffrey Butts, director of the Research and Evaluation Center at John Jay, says the findings show the cost of medical treatment immediately after the injury. But the data doesn't account for the massive long-term effects, sometimes lasting even for a lifetime.
Once a person is injured by a gun, if they survive it, they may not be able to work for the rest of their life. Someone in their family might have to quit work to take care of them. They may lose their housing because they can't afford it anymore. The emotional drag on the whole family after that happens. So the cost implications just have ripple effects.
Gina Moreno, author of the study, says this is not an isolated problem to the Big Apple, but a national issue.
Putting a price tag on this massive cost to individuals, to communities, we are hoping that would get the attention of people who are not so affected by this, that it is their problem as well, and that we all shoulder this massive burden of gun violence.
In the New York study, inpatient stays for injuries averaged 8 days. The John Jay College researchers examined only at New York City, but other studies have taken a national look. A Harvard Medical School study released last year found that annually about 85,000 people survive being shot in the United States. The first month of recovery costs an average of $25,000.
Before the pandemic even, a study estimated the national costs of just the medical care for gunshots to be about $1 billion, $1 billion with a B. And with the increase in shooting since the pandemic started, it's probably closer to $1.5 billion right now.
In Phoenix, Arizona, 16-year-old Brian Durham Jr. faces untold future medical bills after being shot while working at a Wendy's. The teen survived a 5-hour surgery but faces a grueling and lengthy rehabilitation.
So B-Man's A-OK, he's getting better. We want to thank y'all for everything you've done for us, everything y'all doing for us.
Some of the cost associated with gun violence in America is being felt by employers and their health insurance companies. The Harvard study found the rate of workers or their dependents using coverage for gunshot care grew by more than fourfold between 2007 and 2020.
At the moment in the United States, firearms are the #1 cause of death for people under the age of 19. Del.
For every one person shot and killed, 10 people wounded. Axel Tercios, live for us in New York. Axel, thank you very much.